Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, everybody. I'm Greg Keeley. Welcome back to another program, You and Your Doctor, sponsored by All County Healthcare, always here for your home health needs. Medicare certified, serving Miami-Dade, Broward, and Palm Beach County now for more than 20 years. Rated 4.5 by Medicare.gov. Find us at allcountyhealthcare.com. Well, tonight we have a very special guest. Pleased to introduce Dr. Desiree Garzon, podiatry physician for County-wide Foot and Ankle Associates. Doctor, we appreciate you being on the program today, taking time out of your very, very hectic schedule, and we're very fortunate to keep you in South Florida after hearing that you are from here originally. And tell us about how you got started here. You got your degree from Florida State University in exercise physiology, and then it all just kind of emanated from there, huh?
Pretty much. I mean, I always wanted to be a surgeon. I thought originally it was orthopedics, but I followed internal medicine doctor, and she had a patient where the toe audio amputated in her room. So that's where it kind of started, the questions, and she kind of led me, you should really look into podiatry. Just because of the different avenues. It wasn't just surgical, it was wound care. I can pick a niche, for cosmetics, or I can focus on children, or just straight routine foot care. So I was able to make what I want of it. So that's where I kind of was leaning more towards podiatry, and I really just like the different avenues. So if I ever got bored.
That sounds very positive. And you are actually on the lecture circuit as well for the county and the state. Talk about how you feel like it's important to share information with your peers about the importance of, foot and ankle issues across the state and county.
I just feel a lot of people take advantage of their feet. They don't really realize it until almost it's too late. So I just try to make sure that we just kind of express the importance of foot and ankle support. That's what really holds the entire body. So there's so many different things, neuropathy, arterial, just musculoskeletal. I mean, there's so many different components, and everybody needs to be really knowledgeable in how all of the components combine really, makes a difference. So
no question about it. And you mentioned in your notes earlier that your dad was diagnosed with polio, and that really influenced your decision to pursue the medical profession. Could you expand upon that a little bit?
So he's had polio pretty much all his life. So he's dealt with a lot of bracing and a lot of different shoe gear, but that never really, thank the Lord, it never really stopped him from, being active. He was very involved in sports. So that's a lot of what I do in my office. So a lot of patients that have polio, which is not much today just because of what we discussed earlier in regards to the vaccination. But that led me to try to help other people that struggled, that needs bracing, and we're able to provide that kind of service for our patients.
Right. And when you receive a service from a physician, you recognize immediately when someone has empathy. And I'm sure that that's really a strength of your practice. And so that really addresses your need for wanting to help patients and family in that. And what I thought was also interesting about our pre-interview, so to speak, was the fact that your dad assists with your children, and that's outstanding that you'd be able to still be around him and have a chance for him to be with his grandkids and everything. That is outstanding. And so there's other things, there are aspects that we want to cover, and that is the fact that you have two practices essentially in Boynton, one in the east and one in the west. Talk about those practices a little bit and what all you do there.
So my west location is a satellite location. It's ever growing out west in 441. So we really wanted to get our name out there. I also take a big part in the surgery center, the Bethesda Outpatient Surgery Center out at 441. So we just wanted to expand. So I also work part-time, we discussed, in the orthopedic office, orthopedic surgery associate. So I'm kind of spread out, but it's just to let people know that, one, it's a huge thing that I'm a female physician, and I'm a surgeon, I'm a wound care certified specialist, and I also focus on kids as well. So I'm my office is pretty well-rounded. So we just wanted to make sure that, we're here. And believe it or not, a lot of patients actually prefer women physicians, I guess you can say we have that kind of compassion, but, and trust. Thank you.
Yeah, there's no question about it. When you look at a woman physician's life and know that they're probably the person who's most involved with child rearing and then cooking and things like that, how do you keep it all together, Doc?
My husband, my dad.
Awesome.
They're my good support system.
That's fantastic. And so you have other practitioners whom you work with and rely on a lot. Could you talk about them and the contributions that they make as well?
The other physicians? Well, I only work with the physicians in the orthopedic office. They're huge in the sense because I'm the only podiatrist there. So they really confide in me in taking care of their patients, especially when their patients have foot and ankle related issues. So it's really nice, especially, just to have that camaraderie and that support. So it's really nice. I hope that I can eventually hire someone in my office, especially since we're growing pretty rapidly. So hopefully in the next few months, we're going to start putting it out there that we're hiring for someone.
Oh, congratulations. And so what's the criteria for finding a medical professional that really would meet your needs?
They have to be part of a program, a residency program that's rear foot and forefoot focused, highly surgical trained, because I do take a lot of call. We do get a lot of trauma call. So especially if there's patients that need to be seen last minute because of urgent needs, a fall, things like that, or even wound care is a huge thing. So many of our patients tend to fall, and they, a lot of times they can't go to a wound care center. So they could always go to a certified specialist that do that in their office. So that's what I need someone well-rounded.
No doubt about that. And of course, just looking at your background, I think the wound care component indicates that your practice is well-rounded. And then also the fact that you spent 3 years in a residency with a reconstructive program for foot and ankle. Talk about what that was like and how that would differentiate your practice from others.
It's tough. It was tough, but it was such a good experience because that's what our program, or the Bethesda program, the pediatric program, really stands out in comparison to the other programs because they focus on everything. Diabetic reconstruction, flat foot reconstruction in children and adult. You constantly got trauma, ankle trauma. The orthopedics are so good to the podiatrists. So even if it was above our scope, they still allowed us to participate and just expand our learning. We worked with a lot of external fixators, which looks like cages around the feet, so which helps with the reconstruction. It was just a great experience. We dealt with a lot of trauma and just different ways because we had so many attendings work with us that we just learned different techniques and modalities. So it was great. It was a great experience. Hard, great experience.
Well, that's really striking that you in South Florida would be able to offer all those services that maybe someone in another part of South Florida wouldn't necessarily have. So that probably speaks to your growth, and then the fact that you have the empathy that really emboldens your practice as well. So congratulations on all your success so
Thank
far.
you.
It's outstanding. And so in terms of insurance, there are probably a number that you accept. What should people know when they're considering your practice?
In regards of insurance, always call and ask if we accept their insurance. They could always call their insurance company, and just as even online nowadays that you can just look up on your website, the insurance website, and if they see my name, that obviously we accept the insurance. But even if we don't, we do have a special price for the patients of no cash. No insurance. They're cash pay, and we really work with our patients. Especially if they have to be set on a payment plan, or sometimes.
Yeah,
we just have to let them in. We need to take care of them.
It gets difficult, so we appreciate your mission in that regard as well. And so the website then is countywidefootlandankle.com if you are looking to find out more information about insurances accepted. Looks to me like it may be Medicare, Blue Cross Blue Shield, PCO, Oscar, Cigna, Aetna, AARP, and GHI, or at least some of the ones.
Yeah, a lot of the big insurances we take. So, and that's really good.
Outstanding. And so a pediatric podiatrist as well. Speak to the importance of that for your practice.
So we're just starting to expand that. A lot of the patients, especially the parents, they are noticing that their kids are more flat-footed or they're getting a lot of heel pain. So it's really easy to manipulate when they're young, putting in, something as simple as just an insert, and can really help reconstruct or restabilize and reposition their foot and ankle in order to help with development before, the bones really start solidifying. A lot of the bones don't really come in until 8, 9, 10, 11 years old, or their growth plates don't close later on. So a lot of times that's a great time to really manipulate without surgical intervention. So with my kids, I really try to focus on conservative care, and it's been a huge help. I try to be one of the advocates for my kids' schools. So now I just make sure that I let the awareness know. Put out the awareness of, pediatric care. Listen to your kids, watch how they walk, see how they kind of utilize their shoe, see where it wears out, and my daughter, she's flat-footed and actually 1 foot over the other, and I'm constantly putting her in inserts because she's in gymnastics. I don't want her to have that kind of discomfort. So it's a huge help.
Understood, and really that's not something that you might just rush down to CVS and buy. That's something that you need to talk about.
Correct.
To someone like you, absolutely. And so with regard to bone spurs, as we get up in years, there's all those miles that accumulate on your body or whatever, and you have a bone spur and you decide you're going to do something about it. What goes into that? How do you know how far to go with a surgical procedure for that?
Well, it just all depends on the type of bone spurs. There's so many bone spurs that you can get throughout the foot and the ankle. For example, if it's the heel, there's a difference between underneath the heel versus the back of the heel. A lot of times with heel spurs, especially on the bottom of the heel, it can be an incidental finding, and it's not even the heel spur itself that's causing the pain. Usually it's more of a tendinous structure that's attached to the area of the heel spur. Now, when it comes down to evaluating the patient, we do the x-rays. Obviously, we ask them conservatively, what have they done? Stretching exercises, over-the-counter medication, even just, stopping any of the extracurricular activities to see if that's what really caused the issue. Orthotics are a huge thing, custom versus over-the-counter. There's times, depending on the location of the spur, We'll do cortisone injections and immobilization with casting or boots. Now, if all those conservative care really doesn't help, we even offer amniotic injections where patients are really trying to avoid surgery. And that's a little more in depth, but amniotic injections really help reduce the inflammation and kind of help regenerate the area that's kind of degenerative or inflamed. So it prevents the patient from almost having surgery. It's almost like, I don't want to compare it to a cortisone injection, but it has the benefits, it incorporates and kind of, it recruits the good cells to the area in order to allow for appropriate healing. Now, if all else fails, even with and without the amniotic injection, we'll do imaging. We'll order MRIs, ultrasound to really confirm what's really going on. If there's any existing tears or any other issues that are compromising the area, then we can discuss surgery if all else fails.
Right. Well, and that's really refreshing to hear because surgeons often would prefer to operate. And so that's a big consideration for patients to really want to examine all the possible options before moving forward. And so you talked about the x-rays and the custom versus over-the-counter orthotics. How does that differentiate you from other practices? Do you have those things available where others may not?
Yes, so we do have an x-ray machine on site. Over-the-counter orthotics we do, as well as boots, surgical shoes. In regards of custom inserts, we actually now, with the new technology, before we used to cast the patient for a custom insert, but now we actually have our iPad and we actually scan the foot. So we get a 3D model, and it's great because we send it to our podorthist that actually uses that 3D model, so there's no error, and is able to customize an insert or a brace utilizing that 3D model.
Technology that these days, that is so phenomenal. An ounce of prevention is worth a pound of cure, and that goes a long way towards just basically efficiently serving the healthcare needs of folks here in South Florida. That is quite amazing. And so with regard to COVID, it's turned the world upside down now for a while, and I'm sure it probably did for you as well. What happened initially with COVID in terms of you operating your practice?
We took a hit initially, but the good thing is that I was able to provide a lot of home health care, home visits to the patients that really felt uncomfortable leaving the home. So I was able to provide that service. So the good thing is that I was also able to constantly get tested, so it reassured the patient that they felt comfortable. But now, since so many people are getting vaccinated, and we make sure that we still to this day kind of space out our patient appointments so they're not on top of each other. We're not having a lot of people in the waiting room, to reduce the exposure.
No doubt.
So.
And so with regard to elderly patients, I think the statistic is 10,000 people per day turn age 65 in America, and a lot of those folks are down here in South Florida. And so when they come in and see you, you have all these technologies and plans available for them just to basically provide them the right fit, so to speak. Can you speak to that a little bit?
With that fact that we can provide them with so many services.
You have males and females, different feet, narrow feet, wide feet, all that. And so how do you address that? You do the measuring?
So we do the whole exam. We assess their pedal pulses, we assess their neurological exam, musculoskeletal, so we assess their strengths, their weaknesses, we see them walk, so gait is a huge part. So there's some people that have really high arches, flat feet, so depends on, based on their clinical evaluation, that's how we have to evaluate. So everybody's different, no patient's really the same. So it's the basic clinical like I said, the arterial, muscular, the skin, and the neurology that we examine. But at the end of the day, they're all different based on the components that they kind of present at the interview, at the appointment.
Well,
So everyone's different. I mean, it's very difficult to say. We always, every time there's foot and ankle pain, even if it's nothing like if they didn't have an injury, if it's just kind of an onset that just came out of nowhere, we always present with x-rays. So that's kind of like our initial imaging. If God forbid there is some other issues where I feel like their arterial or nerves are being compromised, you know, we also have a great team that we have to outsource as well. So it's a really good thing that I have a relationship with primary care physicians, vascular surgeons, you know, neurologists, because what I do, I need their help as well.
Of course,
So-
that's a great partnership then. Thank you so much for your information so far, and we will be back right after this.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor, sponsored by All County Healthcare, a Medicare certified company. We work with patients in Palm Beach County, Broward, and Miami-Dade for more than 20 years now, led by owners Lou Biazzi and Delroy Clark and their dedicated team. We're located at 4850 North State Road 7, Suite G103 in Lauderdale Lakes. And our main number is 954-717-7027. And we are back with Dr. Desiree Garzon, a podiatry physician with 2 practices in Palm Beach County in the beautiful community of Boynton Beach. And she represents county-wide foot and ankle associates with also, as she mentioned before, specializes in wound care. And we want to make sure we mention where her practices are in Boynton, one east, one west. Dr. Garzon has 2. We have the first one located at 1325 South Congress, Suite 108, and the second is 9868 South State Road 7, Suite 330. And you may either reach either practice by calling 561-369-3300, and her dedicated office staff will provide you next steps, so to speak. So I think we've got about maybe 4.5 minutes left, something like that. And we went over the referral process and how that works and what distinguishes your practice, which is a great many things here in South Florida. And then talk about these different items for the arches. It seems like such an easy fix if you talk to the right person for that, which I believe in this case is you. The arch piece is vitally important because, as you mentioned before, it's so important that you get the right arch and the right fit. Speak a little bit to that more if you could.
So we do a lot of, like I mentioned earlier, over-the-counter versus custom orthotics. So usually I always recommend, as much as I love making money, it's always we're trying to look out for the patient as well. So I always start my patients out, depending on their foot type, majority of the time with just a simple over-the-counter insert. And a lot of times that just goes a long way. It just provides them with good support. But there's times where patients, depending on their flat foot, if it's very rigid or if they have a really high arch, or if they have certain areas where it's more prominent where it needs offloading, that's when the whole custom insert component comes in. So a lot of my patients that do get the custom inserts, they notice a huge difference, especially where they just have bony prominence or other areas that are just very uncomfortable. And that will, contribute to really relieving their discomfort.
Of course, and for the elderly folks, it's the same type of issue, just everybody is a little bit different. And can you tell a story about how you helped someone that was a little bit in dire straits initially just because they didn't have the right insert or something like that helped them move forward a little bit?
So I had a patient where he had a really high arch, and usually with patients that have high arches, they have certain prominence under the big toe, under the little toe, and the heel. And it developed intense pain and calluses. So something as simple as making a custom insert specified to their foot, as well as having almost like a cutout to the areas where there were bony prominence. One, it helped reduce the pain, it helped redistribute the pressure, and two, it almost reduced their callus almost to nothing. So they were able to walk and just provide support.
Isn't that amazing? Well, I bet he is grateful for you and your service, and probably let everybody else know about your service and practice. So we appreciate you letting us know all that you do for patients, and something as simple as that, but you have to have the education and the experience to know that. So we appreciate you so much for taking the time to share more about your practice. Wish you all the best with your family moving forward. And as we wind up our broadcast, we at All County Healthcare appreciate the opportunity to care for you and your loved ones for now more than 20 years in Broward County, Palm Beach County, Miami-Dade. We are Medicare certified and ACO partners for Palm Beach County with a Medicare.gov rating of 4.5. Each and every day, we work tirelessly to help providers to reduce hospital readmissions rates so that our friends and neighbors can live longer and live better. During this critical time of COVID and dealing with often severe respiratory illnesses, please look at our website at allcountyhealthcare.com to learn more about IPV therapy. It can make a difference in the lives of your patients.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed